Welcome to the Physical Therapy Playbook. These short modules are intended to help you get the most out of your physical therapy by better understanding what goes on in PT. I'm James, and I want to thank you for tuning in. You're taking a big step towards ownership of your recovery. Okay, let's get started. I want to start with why I made these videos, and it's three reasons, really. First, medical care is a lot. When we're injured and suffering, we often aren't sure the right path to take to get better. That can lead to less effective care and unanswered questions. Second, physical therapists are getting less and less time to spend with each patient to answer those questions. It's not fair to you, and it's frustrating to us. Because if we don't have enough time with you, we can't share all the important information that will help you get the most out of your physical therapy. So I decided it was time to do things differently and put together an organized guide to help patients with their own care. I've been a practicing physical therapist for over 25 years. No matter what problems my patients are dealing with, there are a few essential facts about physical therapy that I share with each one of them to help us get the most out of our time together. I'm going to share that information with you here in these three modules. It's basically a hack for your success in therapy. So let's get to it. Just a quick note, what follows is general medical information and is not intended to be used to treat any specific condition or diagnosis. Okay, I've organized this series based on the three main players in your care: the doctor, the physical therapist, and you, the patient. In this video, we're going to talk about your physical therapist, the physical therapy process, clinic, and team. First, I believe it's useful to understand the therapist that you're working with. So we'll clarify different degrees and designations that define a physical therapist's education and experience. Next, we'll discuss generally how the physical therapy evaluation will go, what information a physical therapist is looking for, and how we use that information to set goals for your recovery. Finally, we'll spend a little time on communication with your therapist and how he or she will most likely be sharing that info with your doctor. From a 30,000-foot view, your therapist's job is really to take the complaint that brought you to your doctor, work with the doctor's medical diagnosis, and then find a path to get you better through some mix of education, hands-on care, and exercise. So let's get into it in a little bit more detail. All right, so first, let's try to understand the differences between the therapists you may be working with. You can get a good idea of the experience and educational level of your physical therapist based on the letters after his or her name, but sometimes, understandably, this can turn into a whole lot of alphabet soup, so we're going to try and clarify it a little bit. Hopefully this table will help. I know it looks like a lot, but we're going to go one line at a time, starting at the top line. So if your therapist has something like PT, MSPT, or PT, after that name, they're describing their entry-level degree, either a Master's of Science or a doctoral degree. At this point, there are no bachelor's or master's PT programs left, so all PTs at a school have a DPT. It's important to understand that despite having a doctoral level degree, therapists with only a DPT may be straight out of school with limited clinical experience. PTs don't go through a residency like a medical doctor, so their first 2 to 3 years, they're really just kind of beginning full-time clinical care and figuring things out. I'm not at all trying to disparage or throw shade on the amount of work those students needed to do to get to that point, but it is important to understand who you're working with. A therapist who only has PT, MSPT, or PT, DPT after his or her name has done the minimum amount of work to be treating patients professionally. Things like the DSC PT and PhD are post-professional degrees, meaning that the therapist was working on them while working in the field most of the time. They involve ongoing classroom work with either clinical specialization or research or both. The OCS, SCS, and others like it are board certifications earned through the American Physical Therapy Association. Board certifications in a particular specialty, orthopedics, sports, rehab, geriatrics, pediatrics, etc., they require passing a rigorous examination as well as maintaining higher levels of continuing medical education and work in the field. Manual therapy certifications like the ones listed here, and there are many others, mean that the therapist most likely needed to progress through a challenging series of continuing education courses while working as a clinician and then pass a practical examination to demonstrate their skills. The FAAOMT, becoming a fellow of the Academy, is an extremely rigorous process that takes many years, includes some of the certifications already mentioned, as well as a dedication to the field of physical therapy that few clinicians can maintain. These folks are kind of like physical therapy Jedi. Last, there are a couple of certifications that you would typically associate with personal trainers and fitness professionals, but a lot of PTs earn them to enhance our understanding of how to best use exercise, strength, and conditioning to get people better. These are only some of the certifications you'll see, and though they are some of the most common ones, don't be afraid to ask your therapist about theirs so you can understand their experience and who you're working with. Okay, I know that was a lot. Let's move on to what you can actually expect in your PT sessions. So, your care in physical therapy will begin with a physical therapy evaluation. I often have patients ask me, why can't you just read the doctor's evaluation? The answer is that we're evaluating different things. If you watched Module 1 about your doctor, you'll remember that their evaluation was first and foremost focused on making sure you have nothing medically urgent going on. And then secondarily, determining a medical diagnosis to start your rehab out on the right foot. The PT evaluation does a little bit of those things, but focuses more on what you're having difficulty doing. For example, your ability to move, your strength, your balance, and how those things affect your ability to walk, climb stairs, get out of bed, lift and carry things, get dressed, etc. Our evaluation is a bit more detailed than the doctor's because we need to use it to write up very specific custom goals for your insurance company to justify our recurrent treatment plan and you coming in for visits. The first part of the evaluation will involve hearing from you, called the subjective examination. Here we'll want to know what your pain levels are, when you're in pain, how long this has been going on, and what you're having difficulty with because of your problem. Then we will have you go through a few movements to gather measurable data, which is called the objective examination. If you have problems in multiple areas, say your neck and your knee, we would need to do this for each area, which is why I explained to patients that we would need 2 separate sessions to do that. The evaluation is hands down the most important part of your PT. We cannot have success in helping you if we don't really understand what we need to work on. It's how we set up our treatment plan. So let's discuss that next. All right. As discussed in the last slide, your therapist will take the info from the evaluation and work together with you to create goals for your care. Those goals may include things like improving your hip strength so that you can walk up the stairs in your home, or improving your shoulder range of motion so you can reach things up in the cabinets or do your job. Then your therapist will plan treatments to reach those objectives. Your therapist should speak with you about how often you come in for therapy and approximately how long or how many visits it may take to achieve your goals. Obviously, we don't have a crystal ball. I wish we did, but the therapist should generally have an idea on how many weeks you'll be working together. If you and your therapist have not had this conversation, I would recommend you do so at your next session. Remember, this whole process is a collaboration and works best if we're both involved. So we want to work with you to set reasonable goals and a realistic schedule for your care. Not everyone can or needs to come in for PT 2 or 3 times a week. Communicating and working together will set the whole treatment plan up for success and decide how much therapy you need and when you can come in. Okay, let's move on to what you can expect actually during your PT sessions. All right, I want to start this discussion off by putting PT treatment into two general categories: direct and indirect care. Direct care is one-on-one care between you and your therapist. This could include hands-on treatments like massage, stretching, or joint mobilizations. Usually these are focused on helping a person move better, as I like to say, to release a barrier. That barrier could be pain, it could be stiffness, tightness, or lack of joint motion. Hands-on treatments will be targeted to those barriers. Hands-on care also becomes less necessary once a barrier has been removed, so don't expect a massage every session. If you're moving better, we move on to teaching you other things. That leaves more time for the one-on-one exercises. Typically, when you first perform an exercise, the therapist will be there with you to provide instructions, hands-on guidance, and share information on why the exercise is important to you in your recovery. The more independent you become, the more indirect care will be part of your session. Indirect care is generally care either done one-on-one with a technician or sometimes entirely by yourself. A stationary bike would kind of be a good example of the latter. Physical therapy aims to make you independent with your program. That's really what we're trying to do. So there will be times when you work on exercises completely on your own. Indirect care also includes things like a hot or a cold pack or electric stim. All right, now that we understand the difference between direct and indirect care, let's take a closer look at how the sessions themselves go. So I'm going to start out here saying that every clinic works a bit differently, but generally each session should include some time directly with the therapist that evaluated you. It's best to maintain treatment with the same therapist to have the best outcomes for your care. Of course, there may be days that you will see another therapist due to vacations or last-minute appointment changes. If the therapist who evaluated you is routinely not available at the times that work best for you, it may be better just to switch your entire care over to someone whose schedule is a better fit with yours. Because ultimately what you really want to avoid is bouncing around and having 4 visits with 4 different therapists. That not only puts your program on unstable footing, it's tough for the therapists. In each actual PT session, you will likely interact with other members of the rehab team, not just your PT. Often the session will start with a rehab technician, sometimes referred to a tech or an aide, welcoming you in and getting you on a simple piece of equipment like a bike to warm up. The technician may also take you through some of your exercises, especially if your care is going well and you're not experiencing an increase in your pain. It's important to understand that the technicians are there to execute the treatment plan that the therapist set up with your input. You should communicate with the technician if you're having increased pain or problems, but the technicians will not and should not try to diagnose what's causing that. So that's a conversation you need to have with your therapist. Information like that definitely will be shared by the technician to your therapist, but you should talk about it too. We're going to talk about this extensively in the final module because the whole rehab team makes decisions on how and when to progress your program based on your feedback about the exercises. So communication really is key. And the more that you do that, the more that you're involved with your care, the better your outcomes are going to be. Okay, just one more thing to touch on about getting the most out of each treatment session, and that's your home exercise program. All right, as I mentioned earlier, one of the most helpful things we can do as therapists is teach our patients to be independent with as many portions of their treatment program as possible. Self-care is huge, right? Autonomy is important. We understand that a lot of information is coming at you during therapy, and your therapist needs to work with you to help you understand it one thing at a time. The better you understand your treatment in the clinic, the more meaningful it will become. And it is our job to help you understand it all. So please ask questions about anything you're unsure of. PTs are trying to help you better understand your injury, what may have led to it, and the ways to help your recovery and your overall health through exercise and self-care. So there will be a lot of emphasis placed on making you independent with your treatment inside your treatment sessions. So that leads us to your home exercise program. Not all of the exercises and treatments that you do in the clinic will be part of your home program. Your therapist should provide you with a written home exercise program from day one and clearly explain any changes and updates to the program as they happen. Your home program should progress with you through your treatment. It should not be the same program from day one at week 3. If it is, speak with your therapist about it. Okay, let's talk a little bit more about what your therapist will be doing during your sessions. So, throughout your treatment session, your therapist will be documenting how you're feeling, what you're tolerating, how you're moving, and details about your progress. This information is extremely important for your care for 3 reasons. First, the session details are how your therapist stays organized, evaluates the effectiveness of your treatment. Second, each note we write is scrutinized by insurance companies or Medicare or Medicaid to decide whether continued treatment will be approved. Lastly, timely documentation is required from us in order to get your therapy session paid for. These notes need to be completed each day for each and every patient we see. If we fail to do so, we don't get paid for your session, and there's no way you can stay in business doing that. We're not going to get into a conversation here about our healthcare system's challenges, but let's just say providers, like physical therapists, are being asked to do more note writing every day to receive payment for the care we give. Insurance companies are requiring more and more information from us for them to approve your care. What that means on the ground is that we need to be writing a lot of things down during your session, but we will always do our best not to let that interfere with your care and pay attention to what's going on. But understand, we have to spend some time on that laptop writing. So that brings us to communicating with your PT and how we're going to do that. So along the course of your care, the better we understand about what you're feeling, what's getting better, and what's still difficult for you, the better we can help you reach your goals. So during treatment sessions, please keep your therapist posted about how a movement's feeling, if you're having trouble understanding a specific exercise or treatment, and certainly if you want clarification on the overall plan for your care. Between visits, don't be afraid to reach out to your therapist if you have any questions or concerns, if your symptoms are fluctuating significantly, and especially if an exercise or treatment is not being tolerated well. Often, we can reply to you with some simple recommendations to help instead of waiting until your next appointment. Communicating with us also helps us prepare for your next session with a better idea on what to focus on and things like that. Personally, I prefer communication through emails, but many facilities also have patient portals that you can use to communicate with your PT between sessions. Okay, the last topic about your treatment to understand are reevaluations and discharge planning. So let's get to it. So we already spoke about how your therapist will be documenting your progress and your response to treatment during your visits. Periodically, we will gather all that information and, with more of your input, write up a formal reevaluation in the form of a progress note. These notes are important for all the reasons we've already discussed: to understand your response to treatment, evaluate your progress, and justify continued payment from insurance companies. When analyzing a progress note, our patients generally will fit into 3 categories: reached all goals, progressing towards goals, or not progressing. Out of those 3 categories, the only one that justifies much more continued physical therapy is progressing towards goals. Patients who are making progress are responding positively to PT treatment, and continued PT is likely to get them the rest of the way there. For patients who have reached their goals, that's great news. Together, we should be putting together a home program and strategies for getting back to all the things you love to do, with a planned date to formally end physical therapy because you're getting better, you've gotten better. Patients who are not making progress will need an organized plan for returning to their referring provider for further evaluation and other treatment options. Your therapist will work with you on arranging that plan and will certainly be speaking with your doctor. Remember, not all medical interventions work for all conditions, and physical therapy is no different. but there are probably other options that can help you, and that's why it's good to go back to the doctor with the information we provide them. They can offer you potentially other treatment interventions that can help you maybe come back to PT and allow us to start making progress again. So all that brings us finally to how your therapist will be communicating with your doctor, with your referring provider. If your treatment is helping and you are getting better, we'll provide progress updates every so often, but that may be it. If we're having challenges making progress, we'll most likely be reaching out to the doc more often. These conversations are very important to coordinate our care with the medical team and work together to consider everything that can help us adjust or modify our treatment approach. We want to make every effort and use every tool available to get you better, but we also will inform the referring provider if PT is not helping, so they better understand your condition when you return to them for your follow-ups. Remember, your care is a team effort, and to provide you with the best possible outcomes, we all need to work together, communicate, and work towards common goals. Okay, let's summarize this module. So, in summary, regarding your physical therapist and physical therapy, the first session will focus on evaluation and planning treatment. At that time, your therapist will be doing some tests and measurements and talking with you to create a treatment plan. During your treatment sessions, you will work both directly with your PT as well as with assistants or technicians, and sometimes on your own entirely. Your physical therapist needs to document your care in detail to keep track of your progress. Periodically, there will be a progress note written, but your PT will be asking you each session to share how you're doing with them in order to document your response to treatment. The physical therapist and your referring provider will communicate to discuss how the treatment plan is going, and regular communication between the three parts of the team, you included, offers the best chances for a good outcome. Great job taking the time to better understand how to get the most out of your recovery and give yourself the best chances for success. If you haven't watched the other modules in this series, I'd recommend you check them out. There's a lot of information in there that you'll find helpful in understanding the rehabilitation process, the team, and your care. Also, check out my YouTube channel for other informative physical therapy videos as they're added.